This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Eptus T20 kit is a combination of eplerenone and torsemide, designed for adults to manage high blood pressure and fluid retention. It is a crucial treatment option for patients dealing with heart failure. Indications and uses. The medication is indicated for managing persistent high blood pressure and treating edema related to heart failure. It works by effectively reducing excess fluid accumulation in the body, improving heart function and overall health. How it works. Eptus T20 kit functions by blocking aldosterone with eplerenone, which helps in sodium and water reabsorption, while torsemide promotes the excretion of sodium, chloride, and water through the kidneys. Directions for use. Take Eptus T20 kit exactly as prescribed by your healthcare provider. Swallow the tablet whole with a full glass of water, do not crush or chew it. The dosage and duration will be determined by your physician based on your individual health needs, age, and weight. Never stop taking this medication without consulting your doctor first. Possible side effects. Common side effects include dizziness, headaches, muscle cramps, and gastrointestinal disturbances. If these symptoms worsen or become bothersome, consult your healthcare provider immediately. Precautions and warnings. It is vital to inform your doctor of any kidney, liver, or heart issues before starting treatment. Pregnant and breastfeeding women should avoid this medication. Regular monitoring of blood pressure and kidney function is necessary. FAQs. 1. Can Eptus T20 kit be used in children? No, it is not recommended for children as safety and efficacy haven't been established. 2. Is it safe during pregnancy? No, it is not recommended for pregnant women. 3. What precautions should I take? Inform your doctor of any pre-existing conditions or if you are taking other medications. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below. Your input is valuable to us.